All right, thank you everyone, and welcome to the presentation. Dr. Kim is one of our physicians with UCR Health and will be providing today's webinar. If you have any questions, definitely drop them into chat, and I know Dr. Kim will get to them. And with that, I'm going to let Dr. Kim introduce herself and then take over. So thank you again, everyone, and enjoy.
Hi, everyone. My name is Dr. Kim. As you guys already heard, I see Mr. Julio, Miss Sandra, and Miss Stephanie. Welcome to our webinar. So we're going to go over just the basics of high blood pressure. I'll try my best, not to bore you with details, and just like what a patient would need to know to achieve, blood pressure goals for a healthy future. Okay. So I named this High Blood Pressure 101. So if everyone's ready to begin, then I'll start the presentation. Okay. All right. I see a thumbs up. I'm going to begin. Oop. Okay. So I'm going to go over some of these topics: definition, epidemiology, diagnosis, proper, measuring techniques, risk factors, complications of uncontrolled high blood pressure, treatment, including lifestyle, diet, medication, and treatment goals. It'll be around like 20 minutes, okay? And then time for questions afterwards. Okay, what is blood pressure? We ask ourselves. So blood pressure, simply put, is the pressure of blood pushing against the walls of your arteries. Arteries are blood vessels all over our body inside that carry blood from your heart to the other parts of your body. So it's very important to keep all your vital organs healthy, okay, to have a good circulation system and blood pressure. Elevated, untreated blood pressure can damage organs such as your heart, brain, and kidneys. So numbers. Based on statistics back in 2018, about 500,000 deaths in the US included hypertension as a primary or contributing diagnosis. And nearly half of adults in the US, about 108 million, have hypertension as a diagnosis. So it's very common. Okay. And we see tons of patients in the clinic and at the hospital. Roughly half of all patients do not have good blood pressure control. So let's just pretend right now there's 100 million adults in the US with high blood pressure diagnosis. So half of them, like 50 million people, do not have good control. So it would be higher than recommended. The most common reason for office visits and use of chronic medication in the US is high blood pressure. Okay. So very common, but we can do something about it, and that's what's important. And we'll talk about it as we go along. Here are the blood pressure categories based on American College of Cardiology and American Heart Association. So not all, people would agree with this categorization, but this is based on, these particular groups. So let's just base it upon this for now. And, things always could change in the future, like recommendations. But just going over based on these recommendations. So normal blood pressure would be considered the top number or systolic pressure lower than 120 and the bottom number or diastolic lower than 80. If you look at the next row, elevated category means it's the systolic or the top number is 120 to 129 and the bottom number would still be lower than 80. So hypertension category in row 3 is broken up into 2 stages, stage 1 and stage 2. Stage 1 is the top number systolic pressure being from 130 to 139, or the bottom diastolic number 80 to 89. And stage 2 would be systolic higher than or equal to 140, and then diastolic bottom number equal or higher than 90. Okay, so it's a little bit complicated, but I think just to summarize this chart, I would say around 130 over 80 is like what we think of high blood pressure diagnosis, and below that is kind of what we're aiming for to prevent long-term complications. And I have another slide talking about exceptions, where there are exceptions where, we're more lenient with the blood pressure control. And we'll go over that later on. Okay, there's special cases. Okay, location. So, when we measure our blood pressure, we either measure it at the clinic with our doctors and nurses, or we measure it at home, right? Ourselves or someone else might help us. So there are 3 different ways to measure your blood pressure based on location. So like we said, at home blood pressure monitoring. It could be an electronic device. If you guys have a stethoscope and a manual, sphygmometer, you can do a manual measurement, which is probably not ideal outside situation. And the electric cuffs are wrist and upper arm. Okay, I would recommend the upper arm just for accuracy. And, if you compare it to the clinic blood pressure measuring technique, we usually use upper arm. So just to keep it, what you might call it, like the same, So next is the office or clinic-based blood pressure measurement. Usually nowadays it's electronic, but some offices still do manual. Manual is a little bit tricky because it's sometimes subjective, and it's hard to hear sometimes with the noise and inaccuracy of the machine and things like that. So electronic, I would recommend electronic. It's just simpler and it's like streamlined, and it doesn't vary from person to person. And there's something called 24-hour ambulatory blood pressure monitoring machine, where if the doctor has this available in their office, you can wear a monitor and go home, and it'll just track your blood pressure for you for 24 hours, like every how many hours, like every 6 hours, for example. And then you would bring the records to your doctor, and they'll go over it. Okay, but not all offices have that. So just keeping that in mind. Usually when we see patients, it's like based on home blood pressure measurement and office being the most common. Okay, so we ask ourselves, what is the best and most accurate way to diagnose high blood pressure, hypertension? So as we talked about and also mentioned, home readings correlate more closely with the results of daytime ambulatory measurements than with blood pressures that are obtained in the clinic's office. So to put it simply, the measurements you have at home are more like closely resembles what your control is. like normally from day to day. That makes sense, right? Because you're home most of the time. You're not in, the doctor's office. So the blood pressure obtained in the doctor's office can sometimes be, a lot of the time it's more elevated than at home because of the stress, anxiety of being in a doctor's office, parking, and, various things. So usually it's a little bit higher at the doctor's office. It's always best to compare the two locations and get like an average of the different measurements from home and in the office when possible. So, I tell my patients, please keep a blood pressure log, blood pressure diary, bring it, on your visits so I can see like at home it's doing better versus in the clinic it's always high or something like that. Make sure to have the proper equipment and technique for blood pressure measurement, which we'll talk about in the next slide. Okay, I'll just go to the next slide. Proper blood pressure measuring techniques. Calibrate your home blood pressure machine with an office/clinic blood pressure machine. This is so you can bring your machine to the clinic and we can compare the clinic's machine versus your machine so that there's no discrepancy. We know that it's pretty accurate and that it's, functioning correctly, basically. Use an appropriately sized cuff. Not too tight, not too loose. It has to be just right. I have another slide with the measurements, so we'll go over that in a minute, okay? So before you measure your blood pressure, this is important. You have to sit down, rest comfortably, quietly, no talking for 5 to 10 minutes, I would recommend, before measuring your blood pressure. Same at home and in the office, okay? Resist the temptation to talk or laugh during blood pressure measurement, okay? Especially with the person like in the clinic who's measuring your blood pressure. Like say, hey, like, I'm just gonna remain quiet for 5 minutes, I would say. Because most people like when they have an awkward interaction, like they start to get nervous and start talking or laughing. So yeah, so this is important, okay? So because it can increase blood pressure. Rest your arm comfortably on something. Don't like lift your arm up like this. When someone's measuring your blood pressure, you have to relax it somewhere. And usually it's better to relax it like mid chest level, not too low and not too high. And do not cross your legs, uncross your legs. Empty your bladder. So if your bladder is full, naturally you're gonna be a little bit like more anxious or stressed. So empty your bladder. So anything that causes anxiety, we have to like let go before we measure blood pressure. Repeat when necessary. Like for example, you just got out of your car, ran in the parking lot, and like ran into your doctor's office, and you just sat down and your blood pressure is like 180 over 100. Try to repeat the blood pressure measurement like 15-30 minutes later after you calm down and sat down and everything. And the doctor might have, already started the visit, but you can always check again. Whenever I check again, it usually goes down after we talked a little bit. Okay, so this is the proper blood pressure cuff size recommendation for adults. If your upper arm circumference is 22 to 26 centimeters, we use a small adult cuff. So this should be in your clinic. All the different, small adult, large adult, and things like that. 27 to 34 centimeters adult, 35 to 44 large adult, and there's something called adult thigh if your arm is 45 to 52, okay? So hopefully your doctor's office has all the options available. So it's proper and it's not too tight and not too loose. Okay? It should just be snug. Okay, I'm gonna go over some risk factors for primary hypertension. So this is like risk factors, like things that can cause someone to develop high blood pressure. Like why did I get high blood pressure, right? So these are some of the risk factors. Age. Naturally, the older we get, the more our blood pressure goes up. in general, okay, this is like not 100% of the case. Some people in their 20s have like high blood pressure too for various reasons, but in general, the older you get higher blood pressure. Obesity, weight gain, being overweight also promotes high blood pressure. And you can bring it on or worsen it. Family history / ethnicity / genetics. I mean, they're all implying similar things, but your makeup. So, for example, African Americans have a higher percentage of hypertension compared to white Americans. And also like Hispanic or Asian populations have higher incidences of high blood pressure. So that's just an example. It's not always the case, obviously. Reduced nephron number. So this is kind of like, I'm using medical jargon, but nephron is basically what your kidney is made up of. Okay, your kidney is made up of nephrons, like little tiny nephrons, like squiggly. They look like little snails, and you have to look under a microscope. But your kidneys are made of nephrons. So if for some reason you have like kidney damage, or you were born with like a smaller kidney and you have less cells in your kidney, you're at higher risk for developing high blood pressure. This is like a special instance. Okay, most people will not have this. High sodium diet. I'm pretty sure most of your doctors have talked about this to you. High sodium, high salt diet also produces worse hypertension. I have another slide talking about diet, so we'll go over it a little bit more later. It damages the kidneys and worsens high blood pressure, basically. Excessive alcohol consumption. Alcohol generally increases blood pressure over time, so that's not, recommended. Physical inactivity. So physical inactivity goes along with, obesity, weight gain, and just having a sedentary, unhealthy lifestyle. So that's also a risk factor. If you guys like walk like anywhere from 30 to 60 minutes on most days and just try to do like regular exercise, I think it'll be helpful in the long run in helping to reduce your blood pressure and weight and everything. Just healthy overall, mind and body. Okay, guys, don't be scared with this slide. I know I put a lot of things here in medical terminology. So these are some things that can cause high blood pressure in people, young and old. And this is more for like medical health professionals, but I just included it just in case. I'm not going to read or go over all of them. So these are things that can cause high blood pressure, like some medications, like, birth control pill, for example, steroids, and you guys recognize some things like antipsychotic medications can do that. Meth and cocaine can cause high blood pressure, kidney disease, thyroid disease, right? And things like that. So there's a lot of things that can cause secondary high blood pressure. Okay, but most people, it's just primary, meaning you had some kind of half genetic, half like environmental factors that came into play and you got high blood pressure. Okay, so these are like rare causes. Okay, complications of persistently elevated blood pressure. So what's the problem if our blood pressure is always elevated? Like, who cares, right? Well, the thing is, it can damage all your vital organs. Like, let's go over it together. Heart failure, enlarged heart. So because your heart has to pump harder against your high blood pressure in your body, the heart is a muscle. So it's pumping so hard with your high blood pressure that it becomes large, but that's not good. When your heart is large, it's gonna not pump properly. So you're gonna have heart failure eventually. Ischemic stroke. So that's the stroke that you guys see commonly, in elders, where they lose function of half of their body, like they can't move or they can't swallow or speak anymore. So that, that's also a complication of consistently elevated blood pressure, persistently. So if your blood pressure is always high long term, like months and years, like you can get these things, but Also, if it's high episodic, like let's just say you have one episode where your blood pressure shot up like 220 over 100, then you can also get these things. So, we have to be careful and have good control. So it can cause a brain bleed in your head, also known as intracranial hemorrhage. Ischemic heart disease, like heart attack, your heart has arteries. So if you have like clogged arteries, it's called coronary artery disease, and it could lead to heart attacks eventually if it's completely occlused or clotted. And ischemic heart disease just means that the arteries are basically partially blocked. Okay? So elevated blood pressure also can cause coronary artery disease. Chronic kidney disease. So this is big, guys. The kidneys are very sensitive. It's made up of blood vessels and nephrons, like we talked about earlier. And high blood pressure can really damage your kidneys and the vessels in the kidneys. So you can develop chronic kidney disease. Eventually, the next stage is called end-stage kidney disease, where you need dialysis or a kidney transplant. Okay. Hypertension is the most prevalent modifiable risk factor for premature heart disease, being more common than cigarette smoking, high cholesterol, and diabetes. So hypertension is like the #1 cause of heart disease and kidney damage. And, we can do something about it, which is great. So what should we do to treat high blood pressure and prevent future complications? Of course, there are blood pressure medications. And I think there was a question, Mr. Julio, earlier about medications. And I'm sure, 500,000 people, whatever, in the US diagnosed with blood pressure, 100 million. They're on blood pressure. A lot of people are on blood pressure medications. So when do you start it? Well, it depends. If you have other risk factors such as diabetes, heart disease, kidney disease already, or a history of stroke, then it's better to be on a blood pressure medication. Even if hypertension is a new diagnosis. Or if their numbers are severe, like you came to me, a brand new patient, and you're on your first visit, your blood pressure is like 180 over 90, then I think I would treat you, because it's just the number is just so high. And, it might be helpful to initiate a little bit, help out even a low dose, and then go from there with lifestyle modifications. I'm going to go over the lifestyle modifications in more detail. So, hang in there. So lifestyle changes that you can make, or lifestyle modifications. Low sodium diet, low salt diet. We touched a little bit on it earlier, that high sodium diet damages the kidneys, and it can damage the nephrons in the kidneys. Weight loss, if you're overweight or obese, can help lower the blood pressure. Okay. Even 5-10 pounds can already make a difference in lowering your blood pressure. DASH diet. So I have a slide on the DASH diet. So we'll go over what that is. Okay. It's a type of diet. Regular exercise. We also mentioned this a little bit. Okay. There were studies that showed improvement in blood pressure in like a combination exercise program with aerobic. For example, aerobics like swimming, walking, bicycling, like things that pump up your heart. Resistance training is like weightlifting. You can get 5-pound dumbbells and, do some weightlifting while you watch TV, or even like, just sitting down somewhere at work during your breaks. There's different things you can think of. At least 3 to 4 times per week, lasting around 40 minutes. So I would say like 30 to 60 minutes, depending on your availability and your schedule and your motivation for that day and things like that. Okay. So I would say that even a little is better than nothing. So just be consistent. Limit alcohol intake. So no, I would say no more than 1 to 2 drinks per day, and none is best. So there were studies with blood pressure and alcohol intake and people who don't drink alcohol, and they compared people. Okay, so they compared people who don't drink any alcohol and people who drink like 2 to 3 drinks a day. And the group that drank alcohol had higher blood pressure, basically, to simply put it. And the people who don't drink alcohol had lower blood pressure. So, and smoking cessation, of course. Smoking cessation, so there's a lot of reasons. So smoking builds build builds inside your arteries. So that causes heart disease and all that. It damages all your organ systems also, aside from causing cancer and things like that. But smoking is just not good for anything, honestly. So if you're smoking, then you can talk to your physician and talk about quitting, and we can help out with different, agents too. So yeah, no smoking and no alcohol if possible. And obviously stop, illicit drug use. Like we were saying, meth and cocaine can elevate blood pressure. And they do have other side effects like heart attack and stroke and things like that. Okay, so this is the DASH diet. DASH stands for Dietary Approaches to Stop Hypertension. So that's why it's DASH for short, DASH. Okay, so based on various studies with different types of food eating, it has shown that the top 2 types of dietary that have the greatest effect on lowering blood pressure were the DASH diet and something called a lacto-ovo-vegetarian diet. That includes eggs, dairy products as the protein source. But it's like a vegetarian diet, so that includes eggs basically. So DASH only diet. So what is a DASH diet? It's rich in fresh fruits, fresh vegetables, legumes, and low-fat dairy products. So what are legumes? Legumes are like chickpeas or garbanzo beans, black beans, kidney beans. Those are legumes, some of the legumes. And low in snacks, sugars, meats, saturated fats. Saturated fats are like fast food, processed foods, like frozen foods sometimes, like frozen, sandwiches or baked sometimes in baked goods. Yeah, fried foods, saturated fats. The study with the DASH diet included 4 to 5 servings of fruit a day, 4 to 5 servings of vegetables, 2 to 3 servings of low-fat dairy, and I would say just less unhealthy fat. Unhealthy fat is another name for saturated fats that we just went over with processed foods, fast foods, fried foods, and things like that. Versus, you guys heard of healthy fat, right? Healthy fat is like fat in salmon, like omega-3, avocado. Those are healthy fats, and they're good for you. So when they did the DASH diet study with patients with high blood pressure, there was a mean reduction in systolic blood pressure of about 11 points, 11.4 points, mmHg, millimeters of mercury. So around like 10, on average, like 10 points drop from their systolic blood pressure. So if you were always in the 150s with a regular diet with sweets and fats and meats, when people did the DASH diet, the average dropped to 140s, for example, from 150. Now, there's another combination that, we should know about. It's the low sodium DASH combination diet. So aside from the DASH diet, which includes all these things you guys see on the screen, you have to combine a low sodium diet. So what you ask yourself, what exactly is low sodium diet? So the study included 3 groups, okay? One group ate like 3.5 grams of sodium a day. The second group ate 2.3 grams of sodium a day, and the third group ate 1.2 grams of sodium a day for 30 days. So there's a high and medium and low sodium group that was in this study. And the group with the lowest sodium intake, the 1.2 grams per day, had a average drop in their systolic blood pressure of 11.5 points. So basically like another 10 points in the lowest sodium group. And if you do the DASH diet with the low sodium, let's just say like less than 1.2 grams per day sodium diet with the DASH diet, exercise, you might be able to drop anywhere from like 10 to 20 points, I would say. Of course, there are other factors. So, it might not always be like that for everybody, and depending on the situations and things like that. But, on average, this is what they found. So it does work. And it's something worth trying. I mean, it's overall healthy, as you guys can see here, just healthy for weight loss, cutting out sweets, and processed foods and snacks and things like that gives us just extra calories. For diabetes patients, this is also just, these diets are healthy in general, but for diabetes, we have to be careful sometimes with the fruit intake. Okay, not too much fruit intake. The ones with high glycemic index, like bananas, pineapples, the melons, can shoot up your blood sugar. So if you have diabetes, then you got to kind of modify it, talk to your doctor. Okay, watch the sugar content. Okay. So what's best is a combination of lifestyle changes and medications, which are usually used to achieve optimum blood pressure control in most patients. So we combine medication and lifestyle modifications that we talked about. Optimal control of blood pressure is very important, like we said, to prevent complications in the future, such as heart failure, stroke, and heart attacks. And I forgot to put their kidney damage. Okay, so blood pressure target goals. So what should we aim for? Like just so that we have an idea, and when we're home, we can make sure that we're meeting goals. So general goal, I would say top number systolic less than 130, bottom number less than 80 for the general population. Less aggressive goal of giving a little bit of a leeway, aiming for less than 140/90 for the following special situations. If you're someone with a very labile blood pressure, like it goes up, down, one day it's like 90/80 and it's too low. And some patients are like this for various reasons. And sometimes dialysis patients, their pressure drops right after dialysis to dangerous levels where they can get dizzy and fall. So if you're someone like that, then we have a little bit of a less aggressive goal, because we don't want you to get hypotension, which is like too low blood pressure, which is not good. Yeah, like I said, you can fall, you can get dizzy. Side effects to multiple blood pressure medications, and you can't tolerate a lot of medications, then we can give a little bit of a leeway for obvious reasons, because then we don't want to stress out too much, and then less options. So it depends on the situation. 75 years and older. So if you're 75 years and older with a lot of other comorbidities and diseases, then we give a little bit of a leeway. Also just based on age. We don't want to drop it too low, no. Elders with severe frailty, dementia, and or like shorter life expectancy for some reason, like, you're in your 90s, or you have like advanced cancer, then, like the strict control might not be necessary. So then we would give a little bit of a leeway. Okay. If you live in a facility / institution such as a nursing home. So this is also situational. Most people who live in a nursing home also have a lot of comorbidities and tend to be older. So it goes along with the other, reasons here that we talked about. the risk of getting hypotension, which is your blood pressure is too low and causes dizziness and falling in elders and things like that. So then we give a little bit of a leeway. Okay. That we don't have to like aim for 120 over 70. Okay. Like any other medical decisions, guys, it is best to discuss with your doctor on a case-by-case basis to determine what is best for you, depending on your situation, your medical history, and things like that. Okay. Okay. That's all. So any questions? We can go over any questions that you guys have.
Thank you, Dr. Kim. So what I'm thinking is for those, we don't have a huge amount of attendees. So I think it'd be great if you wanted to unmute yourself, you're welcome to ask. If you're not comfortable speaking on Zoom, you're also welcome to submit your question in the chat.